Good afternoon. Again, thank you so much for your patience. Really happy that you are all here and that you've stuck it out thus far. So we're going to stick it out a little bit longer. My name is Wesley Evans. I'm the statewide coordinator of Integration and Recovery Services for the Florida Department of Children and Families. And so I want to welcome you to Families Engaging in Coordinated Systems. This is particularly important because this is an effort that is statewide, that is inclusive and really requires the voice of everyone, and particularly family members and individuals receiving services. So we're going to learn a little bit about recovery-oriented system of care, and then hear from Crystal Lilly about system of care itself. So we've been coordinating a recovery-oriented system of care for the last couple of years, and I'm going to talk a little bit about the approach that we're taking because it's really exciting. It's a transformational approach, and that is really what I think the difference is in the approach that we're taking. And the vision that we came up with through input from multiple stakeholders, which is inclusive of family members and persons receiving services, is to establish an integrated, values-based, recovery-oriented system of care where recovery is expected and achieved through meaningful partnerships, shared decision-making with individuals, communities, and systems. And we're going to learn a little bit about how we're going to do that, how we're going to achieve this vision. We're going to skip the video, though. So why a recovery-oriented system of care? Well, we've seen over the years a whole host of unmet needs throughout our system. Among adults particularly, reporting behavioral health conditions, more than half report the onset in childhood and adolescence. And so if we look at some of the causes of that, we really start to get into adverse childhood experiences in the ACE study that was done out of the CDC and Parliamente. And the average delays in seeking help for mental health and substance use disorder is part of the challenge and can often be as much as a decade. And there are many nuances as to why that happens and that occurs, and I think one of the challenges, or one of the things that keeps individuals from seeking services, is the stigma that it is associated with, and that is unfortunate. But recovery-oriented system of care really seeks to not only create coordination between networks, but also works to reduce stigma. So one of the great things that I feel is that there's choice. And so individuals, communities seeking services actually should be having choice in the type of services that they want to receive. Not just the biggest restaurant in town where you have to eat when you require services. There should be a menu of options presented to you in your communities, whether that's traditional approach or a more natural, holistic approach. We talked about the biggest restaurant in town. Oftentimes that's where we're forced to eat, because that's where everybody gets directed. But in a recovery-oriented system of care, individuals, families seeking services in their communities should be provided with options in how they wish to choose those services, how they wish to seek their recovery path, whether that's mental health, substance use, or co-occurring challenges. So recovery-oriented support is inclusive, and it includes employment assistance, childcare, care management, housing supports that are enhanced with the engagement of families in achieving sustained recovery. Because that's really the goal, is not to put a Band-Aid on treatment. The goal of recovery-oriented system of care is to look at sustainability. How do we offer services and supports that can help individuals and families sustain wellness over the course of their lives. So we talked about treatment and a menu of treatment services, but also recovery support services. We often, traditionally, our system focuses on just solely treatment. But we know that treatment accounts for only 10% of whole health outcomes. The other 70% is inclusive of other factors such as environment, and we'll take a look at some of those factors. And alternative services and therapies. What are we doing to promote other pathways to individuals and families achieving recovery and long-term sustainable health? What are we also doing for prevention in order to get upstream and prevent adverse childhood experiences as well as substance use and mental health? So I think if we can get upstream and prevent adverse childhood experiences, I really think over the course of the long term, we will see substance use and mental health challenges reduce in our communities. So again, why recovery-oriented system of care? We see low pre-treatment initiation rates, and one of the treatment practices, or practices actually, not treatment practices, is an assertive outreach components. How are we reaching individuals? How are we reaching out into our communities so that folks feel that they can engage in services? And if there is, sometimes there are wait times in between initial intake into services, and we see as a result of that, folks not showing up to receive services because they've not been actively engaged. And so one of the things that a recovery-oriented system of care seeks to do is close that gap by performing services such as assertive outreach, so that folks can be oriented and engaged to the services that they are likely to receive upon intake into those services. But we also see limited retention in treatment as well, especially if an individual's experience is negative. So how do we prevent those negative experiences when an individual is engaged in treatment? What is the approach that providers and our communities are taking to treatment delivery itself? We see a lack of continuing support. Sometimes, just for an example, in specialty court programs, whether that's substance use court or mental health court, sometimes individuals are voluntarily part of this program for 6 months, a year, 18 months, in which they're receiving very intensive type services as a condition of that court program. But what happens after that? What happens after the individual completes the court's requirements? Sometimes that and those services fall away, and the individual is no longer wrapped around with services and supports, and the individual sometimes chooses to disengage after their court requirements are completed. What are we doing to keep those individuals engaged so that they can sustain their recovery over the course of, over the long term? One more thing.
Maybe that's
Would you?
an easy
Yeah.
fix.
Oh, there goes.
Oh.
Take that away.
Back.
No, forward. There we go, seems to be working now. We see multiple cross-system challenges. Child welfare, often mismatched services offered to what families' actual needs are. Traditionally, it's been very prescriptive. We know what you need this. Meanwhile, families are articulating other types of needs. So, is our system listening to the needs of the community? So some of the community challenges that we face in our efforts to try and move forward in sustaining long-term wellness over the course of individuals' lifetime is people with mental health conditions are often isolated and not engaged with their communities. And we know that people live in communities. And recovery doesn't happen in the physician's office, it doesn't happen in the counselor's office, or the community provider setting. Recovery happens in the communities. How are we connecting individuals, families, to those natural supports that are going to help after treatment or formal services are no longer needed? And again, there we see the stigma that often keeps individuals from engaging in services. And one of the biggest things, how do we know where to turn? If we're not system involved, either in some way, how do we know where to engage? How do we know who to reach out to? One of the things this recovery-oriented system of care seeks to do is educate the community so that folks know where they can turn when they need services. So some of the intersecting challenges, an analysis of current state. We know disjointed, fragmented systems, systems and providers often working in silos, not working together, and having conversations at the same table. Reactive system. We have a very reactive system, and that has created a culture which has only focused on what is needed right now. And in some respects, that's what we have to do right now, is we have to rush and we have to provide services immediately. But how do we move beyond that? So we are proactive, a proactive system that is not only just reacting to a certain crisis at a certain time. How do we build that sustainability? Deficit focus. What approaches are we taking when providing services? Are we focusing on individuals' family strengths, or are we solely focusing on the deficiencies in the immediate problems? So what is this ROSC thing you speak of? So a ROSC is a values-driven approach. It's not a model, it's not a curriculum, it's not something, a binder I can hand to you and say, here's your ROSC, this is how you do it. It is a values-based approach to how we coordinate systems, services, and communities. It's not a model. It's not an infusion of evidence-based programs or practices. That would be an additive approach. We'll just implement this one evidence-based approach and we're good. But we know that doesn't work. And so recovery-oriented system of care is a framework of coordinated networks and services. So recovery-oriented system of care is a paradigm shift. And what we're shifting from is how can populations get healthy to how do we keep people healthy over the long-term course of their lives. Not only individuals, but also communities. So how do we make this shift? So as a conceptual framework, these are all the components of a recovery-oriented system of care. We see housing, prevention, primary health, life skills training, employment opportunities, child welfare, recovery community organizations operated by individuals or families with lived experience. We see services being trauma-informed. We also see schools, academic institutions, and research involved as well. So recovery-oriented system of care coordinates and networks these services all together. So there are 7 building blocks to a recovery-oriented system of care. And number 2 is fully integrated peer and other recovery type supports. Again, we don't want to be reactive, we want to promote recovery for the long term. And we want to align treatment with recovery-oriented system of care values. And we also want to integrate recovery, performance improvement, and evaluation. We want to make sure that we're monitoring our ongoing process in moving towards this moving towards this transformation, so that we can sustain it over the long term. So some of the values and guiding principles is that it's person-centered. We know that term sometimes, person-centered, but how does it get articulated into treatment approaches? How does it get articulated into or integrated into the services that we're doing? If you're familiar with treatment plans, sometimes they're beautiful and they look very person-centered. But what is being articulated outside of those treatment plans? Are those services, those interventions, actually being practiced in a person-centered way? So talking about whole health outcomes, you can see that healthcare treatment only accounts for 10% of overall wellness. The other 70% is a factor of lifestyle and environmental components for individuals. But we traditionally only focus on the 10%. So how do we expand that and take a meaningful approach to how we are helping individuals in their environment, how to improve their environments, living environment, safety, housing, what other types of supports they're getting, lifestyle, smoking, obesity, stress, nutrition. This all comes together as a confluence of a coordinated system to see whole health outcomes improve. So the primary goals of us, and I think we've really been talking some about this, is to intervene early in the progression of illness. We know there is a lot of peer-reviewed research that early intervention is incredibly effective if you can intervene at that first episode. But sometimes individuals don't engage services themselves when they have a first episode experience. How are we getting? How are we outreaching into the community to make sure that individuals feel safe to come in? And promoting quality of life. I think we all want a good quality of life for ourselves, our families. And so recovery-oriented system of care seeks to improve individuals' quality of life. Community integration. So recovery-oriented system of care, services and supports are integrated into the communities. I think traditionally our approach has just been, let's put services in communities where there's the highest need. But then we have to ask ourselves, how are the services then being integrated out into those communities, other than just being under the shingle sometimes? So some common myths about a recovery-oriented system of care is that the primary focus is on adding peer support providers. And that would be just an additive approach, and we know that's not effective. Or that we're making small tweaks just in services, or the evidence-based programs that are being delivered. So we talk about approaches a bit, and there are 3 approaches. And the additive approach is just taking a look at adding some more community-based supports, or a selective approach, just changing some of the evidence-based practices, or just adding a new type of service, peer support service. And we know that's not necessarily effective. So what we've chosen to do is to take a transformative approach. And in a transformative approach, it's a process over time. If we want to see long-term sustainable outcomes, it's going to take time. And so that is what we've decided to do, is take this type of approach, because we're talking about changing the culture of service delivery itself, and changing how individuals, service providers, and communities view mental health, substance use challenges, and how those services are delivered, how individuals that are providing those services, how do they think about mental health and substance use. One of the most exciting things is recovery capital. It was on the slide before, but that's okay. Is recovery capital. How do we assess recovery capital for individuals and families? We know that recovery capital, housing, employment, family, friendship, relationships, connection to faith-based communities, natural supports in the communities, recreational activities, those speak more to quality of life than what we traditionally focus on. And we really don't measure the outcomes of quality of life for individuals. But we know that when an individual's quality of life is improved, health is improved as well. And there's a partnership consultant relationship. So rather than being a hierarchical relationship between the treatment provider or the service provider and the person or family receiving services, it's a partnership relationship to where there's shared decision making and the person receiving services is driving the direction of the service. So community, been talking a lot about community and how we get the community involved. And this is particularly important in where you all can come into the fold in helping to shape this transformative process in service delivery. Talked a little bit about already the transformative approach that we're taking. We're changing the nature of treatment and services itself to align with those values that I've been speaking about in a recovery-oriented system of care. So 2 years ago, as a part of this transformative approach, this initiation, we decided to host a series of summits around the state. We initially planned for 8 summits, 1 in each of the state's managing entity regions, but to this day we've ended up hosting 13 summits across the state. And so during those summits, we started to ask questions, and we made sure that we were consistent with these questions in every summit. And part of that reasoning was we wanted to hear the needs and concerns of folks, community members, persons receiving services, and providers as well, stakeholders. What do we need in order to change our behavioral health system? And we also put together an environmental scan that we disseminated out into the community to also get feedback and responses from individuals who weren't able to attend the summits. Out of all of that information that we collected, it was analyzed and aggregated and pulled out 5 priorities that we really feel, and the statewide attendees to those summits feel are necessary to launch this transformative process. And what we see is the need to promote collaborative service relationships, bringing systems and services together, providing training and technical assistance. That plays an important role in how actual recovery-oriented values and concepts are practiced, but it's also important when we look at sustainability over the long term. Promoting community integration, how are services networked and integrated into the community, and increasing peer-based recovery support services. Everybody familiar with peer services? Individuals with lived experience actually providing recovery support services. And we also want to develop a strong recovery-oriented workforce. In the responses that we got back from the environmental scan and through the conversations that we had during the summit presentations, we started to hear that those terms, those recovery terms, recovery values such as person-centered, we know those, but we don't know necessarily how to actually practice them. And so we saw a lot of familiarity with the values and concepts, but actual practice was something else. And so this is one of the reasons that we want to continue to develop a recovery workforce. I talked about this being a process over time and a transformational approach, and really had to think about this in phases. So for the last couple of years, it's just been about disseminating the knowledge, getting the word out there about recovery-oriented systems and what it is. And really, that has just been laying the foundation and getting that out there. While we're still in phase 1, we are now actively stepping into phase 2. But you can see these are running alongside and occurring simultaneously. So now it is about broadening and deepening the understanding of a recovery-oriented system of care. How we are pushing it down at the provider and the community level to look at recovery management itself. And then in phase 3, it's contextual alignment. How are we weaving these concepts and these values into administrative policy itself, and establishing change of culture that will sustain our efforts over the course of the long term. And here are just some action items that we're taking for those priorities. How are we going to support or promote collaborative service relationships? What we've done through our federal STR, State Targeted Response to the Opioid Crisis, is we wanted to demonstrate that we really were committed to this actual transformative process. And so in each of the department's regional offices, we created positions that are recovery-oriented quality improvement specialists. And these are individuals with lived experience, because we wanted to honor those values under a recovery-oriented system of care. And
How
so,
do you get that job? How do you get that job? Eat, sleep, and breathe it.
right, absolutely. But we also recognized that we needed to train a cohort of individuals around the state, change agents, out in the community across the state that can actually become the subject matter experts and assist in coordinating these efforts across the state. So how are we going to promote community integration? Because it's critical to provide more opportunities for individuals and families to give feedback into service delivery or service improvement. And one of the things that we've chosen to do is to revise the consumer satisfaction survey so that that can be actually used in a more meaningful way to inform system improvement. And we've taken those items within the former survey itself and made them more recovery-oriented, and taking a look at how we're improving quality of life for folks. And we want to also increase participation in the state or the regional networks and councils, peer networks, family-run organizations and coalitions to get that involvement, because those are vehicles that can be utilized to inform service improvement.
Question for you.
Yes.
How are you interfacing with the prison system?
I'm sorry?
How does all this interface with the prison system?
I'm glad you asked that question. So, a couple of years ago, as a part of this effort in inviting folks and systems to the table, is we extended an invitation to the Florida Department of Corrections. And they have been very engaged from the very beginning. And so one of the things that are some of the things that are occurring around the state is we're starting to see the integration of persons with lived experience, peer-based service being integrated into the correctional systems. So folks providing in-reach services to folks that are on release status, so that individuals can be engaged when they walk out of the facility into the community, into service programs. So that's just one example of the ways that we're working with the correctional system.
That was the next slide.
Oh, okay. Increasing peer-based recovery support services. What we've seen over the years since the inception of peer-based support services here in Florida, which really formally began in 2006, is we've seen a lack of effectively integrating those services into the provider system. So we need to back up and reverse engineer to understand what the needs are. Services can be integrated and the policies and procedures at the provider level and the services also support the peer-based approach itself.
Question, you said this started in 2006. Is Family Network on Disabilities that has had peer counselors since I moved back here in 1997, they've had peer counselors around.
Yes, absolutely, and
Are they involved?
peer-based services are not new,
Right.
but in 2006, the Florida Certification Board started to develop a certification for the service positions themselves. So that's really what I mean by formalizing.
So they're recreating the wheel that's been going for a long time with Family Network on Disabilities.
It's not recreating the wheel, it's integrating it into an actual more formal process so that there is formalized training and competency examination, testing. And so that really helps lift up that service so that folks see that it's an actual evidence-based approach to service delivery.
Yeah.
And we've seen peers also being utilized on the Florida Assertive Community Treatment Teams, which is actual in state statute as a requirement of that service itself.
I know a lady that's been doing care or either employment with persons with disabilities. She said for 26 to 28 years, and she has a job with a family as a caregiver. Coming to the conference for the first time, she's known nothing about this conference that's been going on for 20 years.
And when I spoke a little bit about earlier about community awareness, that's exactly really what we're talking about, is folks in the communities knowing where they can go, where they can interact with others that may be experiencing similar situations.
So part of that could be Agency for People with Disabilities does not educate, they do not advertise. There are so many people without jobs that could do caregiver jobs and working with people with disabilities, and they don't even give the information to the school system. And again, collaborating for the agencies to know, not to say, well, that's not my domain, I know nothing about it. No, mandate that other agencies have to know resources and supports for families.
I wholeheartedly agree with you, and that's what a recovery-oriented system of care seeks to do.
I'm glad I came.
Yeah,
Yes, ma'am.
okay, I came late because obviously we can't go to all of these.
We started.
They started late, so you're on time.
Oh, you just getting started?
Well,
Pretty
I'm
much.
still getting it.
Okay, because I wanted to know if you had handout, but you don't have handout, but do you take out email? How do we get this here
I'm going
later?
to tell you.
Sorry.
So one of the ways that we look at how we are measuring our success in an ongoing quality assurance method and how we are assessing it, where are we now, how do we improve, how do we sustain. And one of the ways we do that is through a provider self-assessment tool. And with the provider self-assessment tool, which was developed out of the University of South Florida's Florida Mental Health Institute, was developed many years ago, actually. Years of research took to do this, put this tool together. It was piloted and released in around 2010. Piloted among numerous community providers and state mental health treatment facilities as well. But it wasn't fully supported from a leadership level, and so it was never integrated as a part of the routine quality improvement process. But we now have that support to integrate this tool and promote utilization of this tool at provider level. So there are 3 domains within the tool itself. The 3 domains, there are 50 items divided up among these 3 domains. And it looks at administrative policies and procedures, treatment, and community integration. And all of the measures are recovery-oriented, and they include the values that I've been speaking about earlier. And it measures, on a Likert scale, 1 through 5, where are each of these domains? And are they recovery-oriented? And if they're not, the tool is phenomenal because it provides resources and information and guidance on how the score can be advanced in whatever area is shown to be lacking in recovery orientation. And a component of the self-assessment planning tool is the recovery self-assessment tool. This is really an important component because it asks individuals, family members, allies receiving services or connected in some way to the individuals receiving services, how are the services you're receiving? Are they recovery oriented? And if a provider chooses to make this a part of their ongoing quality improvement process, and the tool is done, or the tools are utilized at 6 and 12-month intervals, you will see recovery self-assessment scores improve because providers are actually making the changes in their services. This is just a little bit about peer support services. It sounds like most in here are familiar with that. Peer support services provide hope. They role model recovery through that lived experience, which is really the most valuable tool that peer providers possess. And that is the credential, essentially, is the individual's lived experience. Whether that's a person with primary lived experience or it's a family member or caregiver that has cared for individuals. So, how can you move forward? How can you as a community get involved?
Sorry.
That's okay. I quickly put this map together this morning, just the stars. But what we're doing, one of the approaches that we're taking is we've asked each region to begin establishing recovery-oriented system of care coalitions. And this is the way we integrate it into communities and are inclusive of communities themselves and hearing their voices and their needs, the opportunities we have to improve our services. So throughout the state, we really see coming together strong recovery-oriented system of care focused coalitions, particularly in Bay County and Circuit 14, which is in the Panhandle in Panama City. And we also see strong recovery-oriented coalition in the Suncoast region, in the Tampa area. And different regions have chosen to do to approach this in different ways. And that's what's great about a recovery-oriented system of care, because it takes into account the needs of the community itself. It's not prescriptive. It is based on the values of that of those recovery values. I'm sorry. And so some regions in the Northwest region, the way they've chosen to structure their recovery-oriented system of care transformation is by breaking their region up by the judicial circuits. And so we see recovery coalitions coming together in Circuit 1 in the far western part of the Panhandle, Circuit 2, and Circuit 14. But these coalitions are all coordinated in a network together. And they're choosing different items to work on, different efforts to focus on. One of the first efforts they chose to focus on is the intersection of behavioral health and criminal justice. And they did a sequential intercept mapping as a first part of that process. Where are the gaps? And how are we going to fill those gaps? And one of the questions that's critical to ask is when we're looking at how we're coordinating that network and filling those gaps, we're doing so through the lens of those recovery-oriented values. And that's a critical approach, is when we're looking at developing new services, we're always looking through the lens of those values, asking ourselves the question, is this recovery-oriented? It's my pleasure to introduce to you Crystal Lilly, Director of Education and Training for Federation of Families in Central Florida.
Thank you very much. Are you going to do the
Yeah.
thing? My name is Crystal Lilly, and I work for a family-run organization here in Central Florida. And I'm going to talk to you about a system of care which focuses on family and youth. So the ROSC, and when I kind of separated my head, is for the adults in the system of care, and then the system of care for children and family we're going to talk about now. So what is a system of care? It is a coordinated network of services bringing all different systems together to work together with the families based on their culture and really building relationships with the families that we're working with, and not just giving them something to do, they're done, then sending them on their way because we don't have time for them. Kind of everybody working together to really work on that wellness piece, to get them where they need to be, so that they can live independently in the community with natural supports and not needing all the formal supports in their life. The values of system of care are very similar to what you just heard about with Ross. They're family-driven, youth-guided, letting the family be the primary decision maker, making sure you're getting that youth voice so that they're being heard, so they can speak up and we can find out more about what's going on. Community-based. What that means, when I think about it, explaining it, it is Orange County is really, really huge. So if you're sending them to a provider on one end of the county and they've got to find a way to get there and they don't have a car, that's not in their community. It's not accessible for them. So finding something that is easily acceptable, services in their community for wherever that is in the county or the state.
Excuse me.
Yes.
That's what you guys do. You all help. This is what you do.
We do help with that in Central Florida. So the system of care is a statewide initiative now. So initially it started out with grants across the nation trying to implement the system of care into different, it was counties that would apply for it throughout the country.
Right.
And in 2016, and we'll get to that soon, the state of Florida actually started, I think it was 2016, started a grant to really move this across the state. So they're trying to help those counties that didn't get those grants because they were hard to get. And as with grants, there's not enough for everyone, so you have to apply and get awarded those. But they're trying to really push this movement across the state to help families.
Okay, so there are services down south and up north, not just Central Florida.
Yes, it would push it across the state.
Okay.
That's just where I
We're
am.
pilot counties right now that's working under the grant.
And I have some handouts that I'll give to you guys.
Oh,
It's
that's-
a draft logistic model. That at the end, if you want that, and also I'll get your emails. So if you want more information, I'll connect you to whoever I need to connect you to get information to you.
Is this part of the, I know 2 years ago, I don't think it was last year, it was 2 years ago that this conference had a speaker that had gone through the system, that had been arrested, and she became a success story because of the program she was in. Is this what that came from? It might have been about 216.
I don't
She
know.
was one of
I
the
can't
star
answer
speakers.
that, but that is, I think, when you think about the success, that's the success. You've got someone
Right.
in a revolving door. You've got families
In other
coming
words, she
in.
needed mental health. She didn't need to be incarcerated. She needed help to get out of her pit.
Right, and there's more than one way to get that help.
Yeah.
And it doesn't have to be through formal services. It
Yeah.
can be, there's more ways
And
to
I
meet
think
a
it was
need.
like, hello, police, DA, the prosecuting attorney, hello. When somebody's come through this many times, start looking at what's going on in their life, not just they're a criminal.
Exactly, and I can't say that that's what it was, but
Right.
when I think of having a successful family that I'm working with, it's one that no one knew what to do with,
Right.
but now we're asking more questions and we're meeting those needs. The best way for that family through their culture, which isn't always what we traditionally would have
Right.
thought that might look like. The system of care has guiding principles that we work with, a comprehensive array of services and supports. There's more options, like Wes was saying, a menu of options, and it should be family choice and youth choice about what those options look like, because there's more than one way to get somewhere. And it's not always the way that maybe the provider working with the family thinks that needs to look. It's the way that the family and youth want to get there. They are individualized, no cookie cutter plans with the system of care, because everyone is unique and different. Every family has different challenges and barriers and strengths to get them where they need to be, and we have to look at that as individually as we get to know people and work with them. Services are the least restrictive setting, keeping our families and youth in the community so that they don't need those high-end services, that they're either incarcerated or they are in residential facilities getting treatment, but keeping them in the community. Their families are full partners in those decisions and giving those options and really understanding what those options are. And youth as well integrated into the services so that we can really get to know who we're working with. Coordinated care management that is fluid, so all the systems working with the family, knowing what's going on. Because unfortunately, a child or youth can be attached to several different systems and have several different plans, but everyone coming together to really know what's going on can increase the likelihood of that family being successful and decrease that overwhelming feeling that a family may have if they're working with several different systems. The paradigm shift with our families and youth are changing more to the family-driven approach. So the assessments were usually deficit-oriented. We're looking at strengths, not what's wrong, but what are we going to use to get you, what are the strengths that we can use that you already possess to get you where you need to be. So looking at that in a more positive way. And relationships with the child and family were viewed as they need to carry out instructions. Here's your plan. Get that done. We'll check in next month and see where you're at. But really looking at them as partners in that decision-making process, so that if you're part of something, are you more likely to do that if you have a choice in how you get there to get it done? For the front line, for people working out in the field, like case managers, therapists, the people that have that direct contact with the family, moving from controlled by those professionals to partnerships. Moving from multiple case managers to one coordinator. Moving from family blaming to family partnerships. If you've ever worked in a system or been working within a system, non-compliance, I've heard that word so many times that a family's being non-compliant, and that's really not what they're being. They're overwhelmed, they're stressed, they're tired, they're frustrated. And so understanding that's part of what happens when we're raising children that have these challenges, that we're expected to do all of these things. We're expected to be successful parents. There's so much expected of a parent that it gets very frustrating, and it can look very deficit-based when really pulling those cultures and going from one culture within an agency to working with the family's culture, which can look completely different for everybody that we're working with. So the system of care framework, you've got all these different systems like I talked about where there could be something going on with our families. And each system has their own culture. So if the school system, what are they focused on? Education.
Academic.
They need to make sure you're well educated. That's their goal, to get you in and out by the time you reach a certain age or become successful. What's juvenile justice? What are their focus?
Punishment. It's supposed to be rehabilitation.
But what is their focus is safety. They need to make sure people are safe. They're keeping the child's public safety, the public safety, not the child safety, because the child safety would fall where? Child welfare. So they each have their own culture that they're working with. And if you've got a family that's working with the school system because they have an independent education plan, juvenile justice because their child picked up something in a store and walked out the front door with it because they were upset or had an episode in the store. Child welfare because the neighbor down the street saw them on Smack. Who knows what that day looked like? I've had experience raising a child, and my husband has saved her life we laugh about that. He's a police officer, so he's calmed me down many times. And the behavioral health.